Hello there, I'm Susan Birch and welcome to another A Healthy New Zealand podcast. Today, I'm doing a deeper dive into diabetes. This week's topic comes from a listener's question, what is double diabetes? The term diabetes mellitus means excessive glucose or sugar in the urine. This is a direct result of having too much glucose in the blood. Unfortunately, this has led to thinking of diabetes as a disease of high blood sugar. Because measuring blood sugar is so easy, we ignore insulin, which is the real story behind diabetes. Insulin controls blood sugar. When insulin isn't working, then blood sugar gets out of control. In type 1 diabetes, this happens when the beta cells in the pancreas are destroyed and they can't produce insulin. This is an autoimmune disease where the body's T cells attack their own tissue. In type 2 diabetes, the problem is the body's muscle and other cells become resistant to insulin, so they can't pull glucose out of the bloodstream. In this case, the insulin is high but isn't working, so the blood glucose becomes high. It's a shame that the clinical view of diabetes has no regard for insulin. It only pays attention to glucose, probably because it's so easy to measure. This is terrible for many diabetics as we miss so many opportunities for early diagnosis and prevention. We could easily identify diabetes 10 to 15 years earlier if we would use insulin or C-peptide in the testing. This would save many lives and heartache. Instead, we wait until it progresses into disease and then we treat it with a cocktail of drugs. As the person moves toward type 2 diabetes, insulin starts to increase and they gain body fat, but their glucose looks normal, and it may look normal for years. Over time, the insulin gets higher and higher until the body becomes so resistant to its own insulin that now the glucose starts to climb. And eventually, we diagnose diabetes based on elevated glucose and A1C markers. The other problem with this story is that type 2 diabetics are then told their insulin is insufficient to control their glucose. So despite already having high insulin, they're given drugs that push their insulin up even further. As insulin is forced to higher and higher levels, complicated type 2 diabetes develops. We all know the results of this. It increases the risk for a multitude of chronic diseases. Type 2 diabetics are 3 times more likely to die from heart disease. They're twice as likely to die from cancer and Alzheimer's disease. The worst part is, as the disease progresses, more drugs are given with greater side effects and the quality of life really decreases. So what is double diabetes? It is a combination of type 1 and type 2 diabetes. The type 1 diabetic must inject insulin to control their blood sugars. Just like all of us, the more carbohydrates they eat, the more insulin they need. Because they're told to focus on keeping control of their blood sugars, they aren't aware of the damage that these high levels of insulin cause. They will also become insulin resistant over time, gain weight, and eventually develop type 2 diabetes and all its complications. The solution begins with your diet. We all have an individual tolerance to carbohydrate foods. Some people can eat a lot without problems, and others, like me, can't tolerate very many. Ideally, you want your fasting levels of glucose to be under 5 millimole per litre. Insulin between 18 and 48 picomole per litre, and triglycerides under 0.9 millimole per litre. If you're above these ranges, the first step is to reduce your carbohydrate intake and replace these with protein and good quality fats. Remember the motto for a healthy diet: prioritize protein, fuel with fat, control carbs. Thanks very much for listening. If you would like more of these videos, please hit the subscribe button and share.